Hey, what's up, everybody? It's me, Dr. G, and welcome back to another episode of House Calls with Dr. G. Hey, happy day. I'm so excited to be here. I've got my great guest, Amy Vaughn. You'll meet her in a second. But really, when I started this House Calls with Dr. G, it was all about trying to bring more information to you in an informal setting, but also to continue to create awareness and engagement and hopefully action when we talk about our health and our lifestyles. Today's episode of House Calls with Dr. G is no different. I'm excited to welcome Amy Vaughn to the show. And guess what? This month is Occupational Therapy Month, the month of April. And we're going to talk about creating more awareness about what occupational therapists do. And on my show on April 24th, entitled OTs to the Rescue, you're going to find out much more information about the importance of occupational therapists. So allow me to introduce my guest today, Amy Vaughn. I'm going to read her credentials because her credentials run deep. So Amy Vaughn, it's true. So Amy Vaughn is an occupational therapist and Naperville clinical coordinator. She's at Easter Seals, DuPage, and Fox Valley. Check her out at the website, www.easterseals.com. Amy, welcome to the show.
Thank you.
So,
Good to see
so
you.
we met a number of years ago with my daughter Ava, and my wife and I had our daughter Ava start working with Amy because Ava was suffering from a condition called sensory processing disorder. And Ava, as she liked to call it when she was working with Amy, we call it food school. And so I actually got to go a handful of times. My wife went most of the times with Ava, but it helped her. Occupational therapists do so much to get people to be independent in their lifestyle and to live to their maximum potential. And this show that we're going to be doing, even what we're talking about today, is going to be something to help out and create awareness. So, Amy, let me ask you this.
Yes.
What is the role of the occupational therapist?
Well, I think for an occupational therapist, it's to help people live their best life, which means helping them be independent as possible in daily living activities.
Excellent. Now, how long have you been in practice as an occupational therapist?
Almost 11 years in August.
All right. And let me ask you this. What's the best part about what you do as an occupational therapist?
Oh my goodness, there's so many parts. I really enjoy working not just with the individual, but with the family. I think that that's very helpful. I really enjoy seeing people meet their goals and become more independent. And oftentimes a kiddo, I work in a pediatric practice, they will really show me different skills and different ways to address an area of complication or difficulty for them. And so I feel like I'm constantly learning and growing in what I do every day.
I think that you hit the head on the nail. One of the great things about what we do, and me as a physician, and certainly you and what you do in clinical practice, is that every day is an opportunity to grow. You know, we have to be flexible as professionals. We have to continue to stay on top of what we do, but not be afraid to learn new things in hopes that it helps to return the favor and pay it forward for the patients and the clients that we serve. You know, one of the things I like about occupational therapy is that it can cover any age, any discipline, and that is a fact. So let me ask you this question. What's one of the biggest misconceptions that you hear about occupational therapists?
One big one is that we only address the arm, like hand to shoulder. That's the biggest one. I'd say another one would be, that some people will be like, oh, you only work with adults or you can only do this. And really we are across a variety of settings. That's like another misconception. I often, if I'm at a dinner party, people will come up to me and be like, so occupational therapist, you help people get jobs, you work with people, just for that. I'm like, no, I'm not a recruiter. So those would be some of the top ones.
So one of the things, I have to tell you an honest story, one of the things that I used to always think about when I first learned about occupational therapy a long time ago, this is when I was a pre-med student, I actually thought occupational therapy was only about making casts. When you break your arm or you break your leg, and the occupational therapist makes a cast for you. And that was my very, very one-sided, limited view of what occupational therapy does. And of course, as I've been in practice, I mean, the scope is unreal. Everything from what you've helped out with our daughter, with sensory processing, and helping her be more comfortable about food and tasting, movement. I think about the patients that I have in my practice that have had stroke or debilitating conditions, and occupational therapists come and help out a lot. So I just love what you're doing. Let me ask you this. What's like your typical day like?
Okay, good question. So I'm in an outpatient clinic, and typically therapists would work like 8 to 10 hours a day, and we would see a kiddo from 60 minutes to 45 minutes, just depending on the session time. However, I also do a contract with a therapeutic day school for emotional and behavioral disorders, so I do that One morning, I'm certified in early intervention, so I go into people's homes, birth through 3, and work on skills there as well. So I really like the flexibility, like you said, not just in a career choice of what setting you want to work in, but also even throughout my day, I have flexibility in what I can do.
I like how occupational therapists, as I've been prepping for the show and prepping, of course, today for today, I just like how there's just such a diversity out there. From my practice, a lot of stuff is hospital-based or outpatient-based in the clinic, but it's so much more. I mean, I've heard of occupational therapists going to the work setting, the school settings,
Right.
and just getting beyond the traditional understanding of what probably the typical person may know about occupational therapy. I think that's why this is important of doing the show, is to create this awareness. So let me ask you this question. When you think about occupational therapy, how it's evolved over the years, where do you see this going, or even like how has it evolved?
Well, first, how it's evolved, it first started out with therapists working with soldiers when they were wounded and came back from war. And then there was also a piece where they worked with, and still it's very strong in the mental health community, but it was also working on like habit forming, so people trying to return back to school, getting back into their habits. And so obviously that's continued and expanded from there. I do see in the future there is more of a push towards consultation coming in. A lot of therapists will go into a school setting or maybe a mental health setting and do more like consultation with the staff. So maybe not as direct as unfortunately I think is beneficial, but I see some of that happening, a lot more public education, maybe a lot more community programs, pairing with different communities. I think that would be beneficial too.
Excellent. Well, here's what I think. That is awesome that you guys are so engaged in doing so many things and good things, and I think it really takes a village. Me as a physician, you as a therapist, but we do so many things. Even though we look at things a little bit differently from a different kind of perspective or a hat, we're all trying to help get those same goals, don't you think?
Right, totally. Absolutely.
Excellent. Well, I tell you what, I'm so excited that you guys had a chance to meet Amy. I tell you what, on April 24th at 4 p.m. Central Standard Time, I'm doing my show, Occupational Therapist to the Rescue. Check it out on Facebook, and we'll catch you later. Thank you, Amy.
You're welcome.
Peace out.
Peace out.
Bye.